So here's a tough question. How do we survive death? I don't mean how do we avoid dying or what is the best medical intervention to stop the end of life from happening. Instead, what I mean is, how do we experience death around us, with those close to us, and survive it ourselves? I've come to know a thing or two about survival, mostly through my work out on the frontiers of wilderness, through my work in search and rescue as an emergency doctor. And some could say that, in a way, I try to stop people from falling off the edges of their lives. In other words, I try to stop people from dying. Whether I'm on my skis or hanging under a helicopter as part of my role in rescuing people, when I am up there in the mountains, I use my medical skills in life and death situations that I never dreamed of before. Imagine no more ER. All the gear that I have to save someone's life, or to at least keep them alive for the time being, has to fit in the small pack on my back. My first mission, a massive snow avalanche that buried a huge group of skiers in the dark cold of winter. And although we saved 14 lives that day, there was one life we couldn't. And when you do CPR in the dark of night with a blizzard raging all around you, leaving you so cold that you can no longer feel your hands, that teaches you a bit about survival. There's these sort of experiences that have always made me wonder, why do I want to be there in those difficult times? Not just for the patient, but for myself as well. For me, becoming a doctor forced me to become very comfortable with the unexpected. Here I could stand at the very brink of life and death, whether I was in a hospital or up on the peak of a mountain, and I could try to keep my patients alive, keep them safe. I knew that would be hard at times, but not as hard as I had ever predicted, because in truth, it has been even harder than that. As it happens, I've done most of my learning about this on the job, and the real learning, the kind that sticks with you, the kind you will never, ever forget, that happens because your patients teach you. And sometimes the more difficult those lessons to learn, the more and more they resonate across our own personal landscapes. So I want to tell you about one such patient. Her name is Misha. Misha is important because it is the one case in my life as a physician that will always have changed the way that I think, the way I feel, the way I am. And although this is not a rescue story, it is a story about surviving. I'll begin by telling you that Misha is no ordinary girl. In fact, she has been called 1 in a million for being a remarkable and compassionate, gifted young girl. Not gifted as in straight A's or a virtuoso violin player in kindergarten. Rather, she can be described as gifted for much more important reasons. Extending herself to a stranger in that moment of awkward silence or uncertainty. Connecting to show compassion when it would be easier just to turn away or be angry or upset. And sensing when anyone in the room just needed another human's contact, to be included by just giving them a simple smile. Misha is certainly incredible and has wisdom beyond her years. And for all of this, she can certainly be described as 1 in a million. Medically, however, Misha is in fact closer to 1 in 20 million. Having a rare form of an already very rare disease that at the age of 3 had her body stop making any more blood. It was so rare, in fact, that it took over a year and a combined effort across multiple countries to figure out the diagnosis. Dyskeratosis congenita. It's a tough one. It affects every part of a patient's body, as the very life code that we all live by, our DNA, is prematurely wiped out in a perfect storm of errors. Now imagine, just for a moment, that you are this young girl, or it's a girl you know. One day you're taken from your normal life and your body begins to physically fail. Suddenly dependent on blood transfusions to get through each day, the medical team uses intense chemotherapy to bring you to your very own brink of life and death. just to trick your body into taking a stranger's selfless offering of bone marrow as your own. Your bones are so fragile that the very act of sitting down in a chair has already broken your leg twice. Your lungs, they inhale this profound relief from the oxygen mask that you must wear all day, much like some high-altitude climber. Yet your goal is not to reach some distant summit. Your goal is simply to stay alive. Those common scrapes and bruises of childhood, they take hours to stop bleeding, weeks to heal, and your heart races nonstop, each beat a fight for life. Now, most people are unaware that sometimes in medicine, us doctors and nurses, we've done everything possible within our human reach, and we can do no more but helplessly hope. This is one of those times. And this doesn't just go on for weeks or months, but years. Having spent the majority of your life now in hospital, you're now 10. And while you try so hard to be brave and to keep going like everyone tells you you should, you whisper to yourself over and over and over again while tears well up in your eyes, if I could just be a normal kid. Such big stuff for a small girl. Yet somewhere inside of Misha, there consistently has arisen endless courage, sky-high bravery, and still gratitude. Gratitude for every breath, every new experience, and every person that she has found a way to crawl into their heart to seek refuge from this storm. As many patients' stories go, however, Misha's strength soon started to fade, much like the light. And everyone around her could see this, those setbacks coming one after another, and soon these hills turned into mountains, and soon these too suddenly seemed insurmountable, far, far too steep to climb. Despite trying to put one day in front of the other, things were sliding backwards, as if she too were in that avalanche, starting to crash down. No matter what new procedure or new surgery or new medication was tried, we all watched as the handle on the situation and on Misha slid away. It was then she mentioned some very deep thoughts for a 10-year-old. Like, what happens when we die? Does it hurt? And is there a way we don't have to die? Can a person survive dying? Where had these questions come from? More importantly, where could the answers be found? That was hard for me as a doctor. Looking at those beautiful young brown eyes, how could one stand on that edge of the abyss to explain what death is? And for that matter, how do you even begin to talk about dying? Because to do so felt like it would be erasing all hope, even at a point when we all just wanted to hang on and find a way out of this. I was unable to go there, completely lost for words. I mumbled something to change the topic, just to make myself feel more comfortable. Well, she must have read between my lines because something happened. You could sense it and you could see it. It was almost like a map had been unfolded and she had found a way to move forward. It was as if the worse she physically became, the steeper that path she had to climb, the more alive she felt. I heard about a sweet note to a boy that she had a youthful crush on, no longer afraid of what he would think or how he would react. And when he called her to say hi, she said it was a clear sign of a love that was meant to be. She spent more time with her little sister Esme, together always on that same childhood team. Esme's adoration gave Misha strength and hope and sisterly power when no adult could. And now Big Sister started imparting those same life skills of compassion and perseverance to her little sister, as if a baton was being passed in this final stretch of the race. And then there were the moments with her family and friends, young and old. Now she extended herself more than ever and connected with those around her, placing such value on telling each person what they meant to her one by one, as if with each of them she had found some small, precious nugget of gold to hold on to and admire. It was clear now she wanted to be free of the little things that didn't matter and the big things that didn't matter anymore. As if every day was just a normal day for a normal kid in a big, normal world. Misha told me nothing came closer than the simple wonder of a waterfall. Seeing and feeling that cool mist spraying on her face, the sun's light creating rainbows that you could actually walk into. The thrill of knowing that they're only there momentarily in time and knowing that something so real existed, yet is impossible to hold on to. So when we each ask ourselves, how can we possibly survive death? How does any one of us, even a child, knowingly or unknowingly face the possibility that you might die? I think of this young patient because somewhere inside of Misha, she had answered her own difficult questions. She decided that letting go of any hesitation, any inhibition, or regret was the way to survive this. Fearlessly reaching out over that edge and pulling her loved ones in closer to her to tell them exactly how she felt was the way to survive this. And lastly, when we face the hardest of moments, look for life's rainbows. They are there. Those fleeting, beautiful moments that we all cherish that fill our life with rich color and wonder and purpose, even if we can't hold on to them. This patient taught me to stand with her at the very brink of life and death. And that was the hardest moment I've ever faced, because I'm also Misha's mother. Only a few months later, she really struggled to breathe one night. We rushed her to hospital. We were told there was not much time left, but I was afraid as a doctor, and especially as her mother, to tell her that the end may be near. Instead, I hung on with everything I still had. Hours passed. And through that noisy breathing machine and beeping monitors and the endless IV lines in that ICU, she woke, she looked up at me, and she whispered, "Please, let me die." In that moment, despite my years of hanging on to both her and all of my patients in both my roles as a mother and a physician, all I could say now was a quiet, intuitive yes. I had done everything I could as a mother, as a doctor, but I realized I could no longer ask her to hold on to this edge of life for me. I paused for that long moment, that moment between life and death. And I whispered back something that she had now taught me so well. Yes, it is okay to let go. To say we miss Misha is a universe of understatement. She passed away in my arms not long after that. And in that moment, I somehow knew that Misha had reached the top of that mountain. But instead of falling back down from the summit, she instead had chosen to fly. These days, when I get into a helicopter to go rescue someone from that very brink of death, I look for waterfalls as I fly through the mountains. And it reminds me of her and how she also rescued me in her own way with each lesson she gave me. Whenever a rainbow forms after a storm, I prepare myself for the torrent of messages telling me how much Misha is right there, still present, and has very much survived dying in the minds and hearts of all who knew her. This was the greatest lesson of my life, that my purpose as a doctor is not to stop people from dying, but to allow them to live. And as a mother, and as with any of us, that we can draw enormous strength from even the hardest of life's moments and survive. Thank you.